My name is Jasmin Barrera. This is going to be my blood transfusion checkoff video. So to start off, I want to check my MAR and physician orders. So I have Wanda Chi, MR number 87292301, date of birth 9/20/19XX. She has no known allergies, and then I have 3 orders, all 3 for 8 o'clock. So I have check hematocrit and type and screen stat, infuse 2 units of packed red blood cells over 4 hours. Each one of them is 500 milliliters each. Infuse at 50 milliliters per hour over the first 15 minutes. And then monitor vital signs per hospital protocol. Hospital protocol for monitoring vital signs is going to be, I have to check my vital signs before starting the blood transfusion, 15 minutes after transfusion has begun, and then once the infusion is complete, then I would take my last vital signs. Okay, so that was my physician orders. I want to check my MAR. Okay, so Wanda Chi, MR number, date of birth 9/20/19XX, no known allergies. Again, all 3 are at 8 o'clock. Check hematocrit and type and screen stat. Infuse 2 units, 500 milliliters each, pack red blood cells over 4 hours. Infuse at 50 milliliters over the first 15 minutes. And monitor vital signs per hospital protocol. Okay, so before I step into the patient's room, I do want to gather my supplies. I'm going to go ahead and look at her hematocrit and then type and screen. So her hemoglobin and hematocrit were low. And then her type and screen, she is AB negative. Okay, I also want to check whether or not my patient signed their consent form. So it says here that Miss Chi did sign her consent form. I am also going to verify when I step into the patient's room. Okay, so now I'm going to go ahead and gather my supplies. So I'm going to have a flush because I do want to check the patency of her IV. Some alcohol swabs. I'm going to be using normal saline because that is the only thing that can run with blood. So want to make sure 500 milliliters. And then I also have my white tubing. So I want to make sure that nothing is expired, that has been previously opened, everything is new. Okay, now that I have that, I still don't have my blood. I want to go ahead and I want to do the math first, so that way I'm prepared for those infusion. So to start off, it is going to be 50 milliliters per hour for the first 15 minutes. But after those 15 minutes, I do have to remove the 15 minutes from the 4 hours, and then I have to remove how much was infused over those 15 minutes. So it's going to be 12, so that's my math. 12 milliliters would have been infused over those 15 minutes. So then the new infusion time after the 15 minutes, it's going to be 488 milliliters over 3 hours and 45 minutes. Okay, so I'm going to perform hand hygiene, step into the room. Hi, Miss Chi. My name is Jasmine. I'm going to be your nurse for today. Do you mind verifying your name and date of birth? So Wanda Chi, 9/20/19XX. Okay, perfect. So we have orders today. We are going to be infusing blood because your hematocrit and hemoglobin were pretty low. So we want to go ahead and restore that. Before we do anything, I'm going to check your vital signs. These are going to be your first vital signs. I am going to be checking them 3 times over the course of this transfusion. And then I'm also going to check the patency of your IV. Okay, so I'm going to perform hand hygiene, put my gloves on. Okay. So again, I still don't have my blood. I'm going to check the patency of this IV port. All right. And I'm going to infuse about 2 cc's. 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 2 cc's Okay, so your IV is working good. Okay, and then now I would take the first set of vital signs. Before I do receive my blood, I do want to go ahead and hang my normal saline. I want to have everything ready. Again, my normal saline is the only thing that can run with blood. It is the only thing that is compatible. I want to make sure that everything is clamped. Okay, and then I only wanted to untighten this a little bit. Okay, I'm gonna unclamp the top. Squeeze here. And I'm gonna go ahead and make sure I get any air bubbles out. Okay, now that my tubing has been primed, I'm gonna go ahead and clamp everything back up. Put this here. Okay, now that everything is set, another nurse would have came in to give me my to bring my pack of blood. So now I want to do my 3 checks with this blood. So I want to first check my MAR. So it's Wanda Chi, MR number 87292301. Okay, that's correct. Date of birth 9/20/19XX, also correct. And then I also want to check. It says infuse 2 units, 500 milliliters each of packed red blood cells. So this is a pack of red blood cells, and it's going to infuse over 4 hours. It's going to infuse at 50 milliliters per hour for the first 15 minutes. So we're only doing 1 unit at a time, and it's going to be at 8 o'clock. So my MAR is correct. Now I want to look at my transfusion records. So again, Wanda Chi, MR number 87292301, that's correct. 9/20/19XX, that's correct. Again, there would be another nurse present in the room as I do these checks. So blood component, packed red blood cells. Okay, it is 500 milliliters. Transfusion record number 123456789, 123456789. Unit number 0085181. Okay, 0085181. Okay, that's correct. Let's see, what else? Okay, blood type, her blood type is AB negative, so that is correct. AB negative, and then it is going to infuse over 8 hours, and then expiration date is March 2020. Okay, so everything is correct with the transfusion record. Now I'm going to be looking at her wristband. Okay, Miss Chi, I'm going to look at your wristband just to confirm again. So, Wanda Chi, MR number 87292301, date of birth 9/20/19XX, unit 0085181. She is AB negative, and then transfusion number 01234567889. Okay, everything is correct with my blood. Now I can start this transfusion. So I already assessed patency. I already took my patient's first vital signs. Okay, Miss Wanda, just to make sure you don't have any allergies, correct? Okay, thank you. So now I'm gonna go ahead and again make sure everything is clamped. So before I hang the bag, I would have agitated the bag just to make sure that there was no leakage, everything was okay with the bag, and then there was no small clots seen in the bag. Again, I would have done that before priming it. So I'm gonna go ahead and hang this. I'm gonna grab this. So I'm gonna unclamp only the blood side. And I'm gonna squeeze until this ball starts floating. Okay, so now the ball is floating. And then I'm gonna go ahead and prime it slowly. I wanna see the pink run through my tubing all the way to the end. So I see it's running. Okay, now I'm starting to see the pink at the end. So now I'm gonna clamp everything back up. Okay. Now that my tubing is primed, I wanna make sure with my math, again, I wanna look at my orders. So it's gonna infuse at 50 milliliters per hour for the first 15 minutes. Okay, Miss Chi, so I'm gonna go ahead and attach this, and I'm gonna be staying in the room for the first 15 minutes, okay? I just wanna make sure that there's no type of allergic reaction. I already assessed the patency of the port. Okay, now that that's attached, everything is good. I'm gonna program the pump to 50 milliliters over 1 hour. And I'm only gonna unclamp the blood side, and I would let that run. So then I would wait for the first 15 minutes in the room. After the first 15 minutes, now that the 15 minutes are over, okay, Miss Chi, it's been 15 minutes. How are you feeling? Everything okay? So she didn't have any type of allergic reaction. I would take my patient's vital signs. So these are going to be the second vital signs. I wouldn't stop the infusion as I take the vital signs. I'm simply going to take the vital signs, and then now I'm going to change the infusion rate. So again, that was my math. 12 milliliters ran for the first 15 minutes. So So I'm gonna go ahead and put 488 milliliters now over the 3 hours and 45 minutes because it has been 15 minutes. So then I would program the pump to 488 milliliters over 3 hours and 45 minutes. Okay, Miss Chi. So the 15 minutes are up. I am gonna be back in about 3 hours and 40 minutes just to make sure, and I will be checking in throughout that time just to make sure everything goes okay. So then I would step out of the room, and then whenever the transfusion is over, I am gonna step back into the room, perform hand hygiene. Hi, Miss Chi. So how are you feeling? Everything okay? So the transfusion is over. The bag would be empty. I'm gonna go ahead and clamp on this side. So I would clamp the blood side, and then I would let my normal saline run. Again, normal saline is the only thing that is compatible with blood. As I let this normal saline run, that's gonna flush the tubing, make sure everything is okay. I would take my last vital signs. After completing my vital signs and making sure that my tubing has been cleared, I'm gonna go ahead and clamp it from the top, and then I would dispose of everything per facility protocol. And then I would perform hand hygiene, make sure that my patient is comfortable. Okay, Ms. Chi, so now the transfusion's over. You do have orders for 2 units of packed red blood cells. We've just completed the first one, and then we will be repeating the whole process for the second unit. So then I would, again, dispose of everything per facility protocol, step out of the room, and then I would document all 3 vital signs, all 3 sets of vital signs. I would also document my patient. I gave it blood transfusion, IV, packed red blood cells. In the left forearm, it's going to be an 18 gauge needle, Wanda Chi 920 19XX. She took the procedure well, no allergic reactions. It was AB negative blood. And then I would also state that it was the first unit and that we would be giving a second unit. I would also chart why we gave the packed red blood cells and that it ran with normal saline. And that is it.